Thank you for joining us this evening and welcome to our community town hall. I'm Christy Brown, a board member at MCW and CEO of Girl Scouts of Wisconsin Southeast. Our goal is to bring the community up to date, accurate information, and to answer questions to ensure that you can best take care of yourself, your family, and your community. Please submit questions as we go through the presentation in the question box in the control panel. For the past several weeks, MCW has had 14.5 million touch points nationwide through multiple channels. These town halls, webinars with many partners, social media, news stories, websites, and others. Next slide. And MCW has been involved in direct community outreach as well. Advancing a Healthier Wisconsin Endowment expedited funding totaling $4.8 million in COVID-19 focus areas, such as high-need vulnerable populations, healthcare provider protection, healthcare access, social resource access, and technology data innovation. David Nelson, PhD, MS, Associate Professor of Family Medicine and Community Medicine through Milwaukee-based Street Life Communities and Freedom's Community Ministries, continues to support efforts to ensure that all community members have access to basic needs such as food, shelter, and healthcare. MCW's current Institute for the Transformation of Medical Education has been an important partner in Mask Up Milwaukee, a community-wide effort to create 3.5 million homemade masks for healthcare providers and other essential service providers. These are just a few examples. If you want to get involved or learn more, please visit covid19.mcw.edu when you can. We have only been able to do this with your support. Thank you for continuing to join us, for sharing with your friends, and for choosing us as your trusted source for information. Tonight is our last planned weekly town hall. With the holiday next Monday, we are taking a pause. But later in the presentation, we will be doing a brief poll to get your thoughts on how we can continue to serve you through webinars or other means. Now, I'd like to introduce our panelists for tonight. Dr. John Raymond, President and CEO of the Medical College of Wisconsin. Dr. Kirsten Beyer, a Spatial Epidemiologist and MCW's Institute for Health and Equity, and County Executive David Crowley. Dr. Raymond?
Thank you, Christy, and good evening, everyone. I'd like to go to the first slide, please. Just going to run quickly through some of the indicators that we follow for the progress of the COVID-19 pandemic in our region. As you can see here, the doubling times in Wisconsin have stretched out to 17.1 days and 20.5 days in Milwaukee. And recall that we started at less than 3 days, so this is good progress. The daily growth rates over the last 7 days are 2.9% in Wisconsin and 3.2% in Milwaukee. And recall that we started out with 35% growth rates in early March. Positive tests of 4,828 administered today were only 144 in Wisconsin and 60 in Milwaukee. Now that's significantly less than we've seen over the last 4 or 5 days. But we always appreciate it when we have a low positive COVID count. There were 2.9% positive tests in Wisconsin, and we're not sure yet in Milwaukee, but we hope it's down under 10%. The testing capacity in the state has continued to grow over the last month and is stable the last few days at about 13,400. In terms of the number of patients in Wisconsin hospitals with COVID-19, there were 379 today, up slightly. 127 of those are in intensive care unit beds. And we have plenty of ICU beds available, with 444 immediately available today. Our capacity for intensive care unit care and ventilators is stable and adequate in Wisconsin. And in terms of our personal protective equipment on the front lines of healthcare, those also have been stable in Wisconsin and in Milwaukee. But we have critical shortages of N95 face masks and hospital gowns. Now, the last number I want to talk about is the reproductive number. And that gives you a snapshot to understand how contagious COVID-19 is in our community on any given day. So for the last 7 days in Wisconsin, the average reproductive number was 1.1, and in Milwaukee was 1.3. I would really like to see that number be down below 1, because a reproductive number of 1 means that one person with a positive COVID-19 test passes that infection on to one other person. So if you want to see the course of the pandemic slow down, you want that number to be under 1. If I could have the next slide, please. The next slide shows the daily numbers of positive COVID-19 tests in Wisconsin since March 12th. And as you can see, we sort of reached a plateau in early to mid-March, and then we had more cases trending upward. And that really started with our increase in testing capacity in mid-March. So we're watching this very carefully. What we know is we haven't really started to decrease yet. We may be at a second plateau, or we may actually be going up a little bit, so that bears some watching. Next slide, please. Just some things to remember now that Wisconsin has reopened, and I think businesses and consumers are struggling to understand what they can do to protect themselves. We need to remember COVID-19 or coronavirus, it's stealthy and virulent. So what that means is it can kill you, it can cause serious damage to you and your loved ones, and it can spread very silently. So you can be contagious even when you feel good. We've always favored a slow, careful restart of the economy, but that isn't where we are right now. So we really need to be careful. So what we need everyone to do is live responsibly with the only tools we have available right now. Physical distancing, maintain and protect your 6-foot distance from people who don't live in your home, face coverings, hand washing, and then frequent cleanings of your home and places that you work or you leave the home for. Now, we all have personal responsibility to maintain our health and safety, not just for ourselves, but for our families, our loved ones, and our community. And we look to the public and private sectors to work together on a mitigation plan in case there's a surge or secondary wave of COVID-19 in our communities. Next slide, please. Now, just 6 principles to think about as we try to resume normal life. We need to give businesses clear guidance about how they can keep their customers and their employees safe. We need to provide adequate personal protective equipment, not just for frontline health care providers and first responders, but for people that interact with the community. So that would be bus drivers, grocery workers, and other people that have frequent contact with members of our community. And we need to educate the public, and that's part of what we're trying to do tonight. We also need to protect the vulnerable, and by that I mean people that have comorbidities or pre-existing conditions like diabetes, high blood pressure, obesity, and elderly. We also need to protect people in congregate living and working situations like meatpacking plants, prisons, and long-term care facilities. And we need to continue to focus on under-resourced neighborhoods and ethnic groups such as African American and Latinos, who are at a greater risk not only of getting COVID-19, but of having serious side effects from it. We also need to work very, very hard to increase testing. Right now, the diagnostic test is done by what we call the polymerase chain reaction, or PCR, and that requires a nasal swab or a cotton tip swab that's placed in your nose and then sent off for analysis. We need to increase that availability for all of our communities. We also need to bring antibody testing into our communities as well, so that we know how many people have been exposed to COVID-19. And then finally, we need to enhance our public health infrastructure to identify COVID-19 positive patients, to trace them, and to isolate their contacts. And that's going to require a higher degree of coordination amongst our public health leaders. Next slide, please. And with that, I'll turn it over to Dr. Kirsten Beyer.
Thank you, Dr. Raymond. With COVID-19, just as with other diseases that affect our population, we happen to see lots of disparities with regard to geography, race, ethnicity, socioeconomic status. And so our group has been focusing in to look at those geographic disparities and disparities by race and ethnicity in Milwaukee County. And so what I'm going to present today are 4 sets of maps. On this first slide, we're looking at cases. And you should be able to see the cases, the maps sort of accumulating over time. So on all of the maps that I'm going to present, Wisconsin Electronic Surveillance System data, or WEDS data, is used to create those maps. We use data at the census block group level, so it's a relatively small geographic unit. The rate that you're seeing is a rate per 1,000 people, so either cases per 1,000 people or tests per 1,000 people. And wherever you see red or shades of red, orange, and yellow, that's where things are higher than other places. So blue is low and red is high. So on the first slide here, we're showing cases. And so on the left-hand side, what we're showing is an animation of cumulative cases since March 12th, which is the first date that we identified a COVID case in the county. And so what you're seeing on the right is more of a week-by-week snapshot. So we take a look at what happened each week so that we know where the infection and where the tests and cases were moving during that week. So overall, what we've seen in these patterns is that COVID-19 infections began in the northern suburbs and also in the north side of Milwaukee. Community spread was more prevalent in the Black and African American community on the north side early in the epidemic. Then as we see things unfolding, we see hotspots on the map that indicate a lot of the locations of nursing homes, long-term care facilities, and other locations where concerted testing campaigns were done and many cases were found. Later on in the epidemic, what we've seen is that the cases have become higher on the south side. So over the last week or two, we've seen a higher number of cases in the Hispanic or Latinx community on the south side of Milwaukee. So overall, generally, there appear to be waves of the COVID-19 infection. First on the north side in the Black African American community, then where we see hotspots locating on nursing homes, other care facilities, and in the bottom left-hand side in Franklin, the House of Corrections, which did a 100% testing campaign. And then more recently in the epidemic, the Hispanic and Latinx community on the south side, including in relation to the Smithfield meatpacking plant. I think you can probably go to the next slide. Okay, so on these, you're seeing an accumulation of the tests that have been conducted in the county. And of course, we know that testing is very important in order to, as a public health response, to keep the virus and its associated disease in check. We need to identify people with the disease and then trace them, quarantine them, and continue to overdo that process repeatedly in order to keep the infection under control. And so what you're seeing here is the tests conducted since March 12th. On the left-hand side, you see an accumulation of those tests, so that those maps are building over time, accumulating all of the tests that have been done. At the beginning, there were more tests following the infections that we found on the north side and at facilities. And more recently, especially as you can see on the incremental map on the right-hand side, there have been more tests conducted on the south side of Milwaukee in the Hispanic community. And so I think it's important to keep track of both of these things in order to really understand what's going on with the epidemic and where things are moving. And also recently, I think you can probably see on the right-hand map, when we get to the point for this past week, there have been 2 new testing sites that have opened in the city of Milwaukee, one on the north side and one on the south side. And the communities surrounding those locations are showing up on that map as having higher numbers of tests. So that's what we'd like to see. That's all I have.
Next slide.
Okay, County Executive Crowley.
All right. Thank you. Thank you, Dr. Raymond. Thank you, Dr. Beyer. As many of you know, this has been unprecedented time here in Milwaukee and across the globe. And Dr. Raymond and the Medical College of Wisconsin have been amazing advocates for public health in the midst of all of this uncertainty. And they have been a critical partner in our community-wide response to the COVID-19. So I want to say thank you to Dr. Raymond and your staff. We have received tremendous amount of assistance from folks like Dr. O'Brien and Dr. Beyer. These folks have provided expertise in epidemiology to Milwaukee County and our 11 health department partners. Their efforts have allowed us to create a local response to the COVID-19, but more importantly, that is truly data-driven. The emergency medicine expertise of Dr. Ben Wesson has also been a critical asset, both in policy development and on our daily press briefings. I also appreciate MCW's commitment to racial equity and the topic of this virtual town hall today. Racial equity is definitely a priority of mine, and we have a lot of work to do here in Milwaukee County, and this has become particularly apparent during the COVID-19 crisis. We sometimes forget that many people are being directly affected, but unfortunately disproportionately affected. I know somebody close to me who had a mother, a father, and a grandmother who all contracted the virus. Her mother did pass away. Her father is back home, and she's finally heard her mother's voice for the first time in over a month. So it's extremely important that we continue to talk about racial equity in the midst of all this, especially understanding that Milwaukee County ranks 71 out of 72 counties when it comes down to health. The disparities are real. And according to the Wisconsin Department of Health Services, they said that a Black person is expected to live 14 years less than a white person in Milwaukee County. This should be unacceptable not only to me, but to everybody here in Milwaukee County. And that's why we're committed to examining and ultimately changing our own policy and practices to address the root cause of these disparities. One of the first steps to doing this is disaggregating the data. We need to understand where the disparities are in order to address them. So I want to thank MCW for your leadership in calling out these disparities. I look forward to working with you to address these disparities and making Milwaukee County a place where everyone can thrive. Thank you.
Okay, thank you, County Executive Crowley. Before we open up for questions, we're going to do the brief poll that Christy mentioned earlier. And what this poll is going to do is going to help us make decisions on how best we can serve you moving forward. So what will happen, I believe the first question's already gone up here. So all you need to do is make your selection, hit submit. So our first question is, if the town halls are offered going forward, do you intend to continue to participate? So we'll give you a few seconds to work through that answer and submit. And about 10 more seconds. 5, 4, 3, 2, and 1. Okay, thank you. All right, our next question is, which day of the week is best? So choose which day you would prefer and hit submit, and go ahead and do that now. We'll take about 15 more seconds. Five more seconds. 4, 3, 2, 1. And thank you. Okay, just 2 more questions. Our next one, which time of the day is best? Again, make one selection and hit submit. About another 15 seconds to make your choice. 5, 4, 3, 2, and 1. Okay, one more question and then we'll get to our Q&A. Which portion of the town hall do you prefer? The presentation or the Q&A? So make your selection here and hit submit. Go for about another 15 seconds. Five, 4, 3, 2, 1. Thank you everyone for your responses. I was kind of watching those come in quickly, so I see that a lot of you participated, and we very much appreciate you submitting that information to us so we can, again, make the best decision on how we can continue these moving forward. And so now we're going to move into the Q&A portion of the town hall. If you have not yet submitted your question, please locate the question section of the control panel, and you can send in those questions. We have been receiving some, and we'll continue. We're going to get to as many as we possibly can. One other thing I'd like to point out is there is a handout section as well in that control panel, and there are a couple of handouts there for you, the slides from tonight, as well as another handout with further information about testing. So to kick it off, the first question that I have here is for you, Dr. Raymond. Is there any indication on how long we will need to continue wearing masks and taking other protections when in public?
Yeah, obviously nobody has a crystal ball, but I would say that until we have a vaccine, that's going to be a way of life for us. And at a minimum, it's courteous to be able to wear a face cover, cloth face covering in public to protect people that are around you in case you have asymptomatic or pre-symptomatic coronavirus infection.
Okay, thank you. And I can ask this as a follow-up since you mentioned a vaccine. How close are we to a vaccine?
Well, vaccines typically take about 12 years to develop, and it's a multi-step process that requires preclinical studies, clinical trials in human beings, manufacturing, distribution, quality control, a lot of regulation, and we're trying to squeeze that all down into a 12 or 18-month period of time. With Operation Warp Speed that was announced last week by President Trump, there's a lot of energy being put into trying to have to compress all of these steps. And it's going to require a lot of luck, but if things work out well, the whole goal is to have 300 million doses of vaccine by the end of this year. There was a really significant development earlier today that was announced by Moderna. They're trying a novel approach to making new vaccines. So again, if everything falls into place, it is possible, although I'd still say not likely, but possible that we could have a vaccine by the end of the year.
Okay, thank you. These next couple of questions are for you, Dr. Beyer. Based on the Milwaukee County case dashboard, it does appear that more Black individuals have COVID-19 than white people, but at the rate at which people are dying is a little higher. Is there a statistically significant difference between the rates?
Yeah, thank you for the question. We haven't done an analysis to look at the statistical significance of the differences. I would say that we are seeing significant racial differences, that, or at least things that look like they'll be statistically significant. But there are some age factors that I think need to be taken into account. A lot of the folks that we're seeing who are diagnosed with COVID-19 who are white are older, and we are seeing younger people who are Black or Hispanic or Latinx diagnosed. So I think those factors need to be taken into account as well. And of course, as Dr. Raymond mentioned earlier, comorbidities are an important element of how deadly the virus is for someone. And we know from previous literature that racial and ethnic minorities have higher levels of comorbidities very often.
Okay, thank you. And another one related to the numbers. How do you explain the big jump in numbers in states where the people have stayed home?
That is a great question. I would say that I am not in that data, so that's a big disclaimer. We're really working with Milwaukee County data at the moment to get some detailed information to help guide the public health response. I think that there are changes in testing capacity that could explain a lot of the increases that we're seeing, I think, in Wisconsin and elsewhere. But having not really delved into the data, I'm not sure if I'm qualified to answer that question fully.
I'd like to weigh in here. Sometimes it's really difficult to compare situations from one state to another, and to oversimplify it and say that the difference is due to either people staying at home or not is tough. But what I can say is people have lockdown fatigue everywhere. And cell phone data show that the first month or two, people were really staying at home. And over the last few weeks, people have just really wanted to go out more, and they've been more mobile. And that's across the board, whether there was a lockdown in the state or not. It's really hard. And I think Dr. Beyer also pointed out that as we bring new testing capacity online, you're going to have more positive tests than you did before. And that rate of the ability to deliver tests is different in different states. And even within this state, there's still parts of the state that don't have easy access to on-demand testing.
Okay, thank you. A couple other questions regarding masks. I am concerned that the wearing of masks not being mandatory in our state or in the city of Milwaukee, where I reside, is going to cause the infection to spread more as businesses open up. What are the panelists' thoughts on this? And what can be done to make this a requirement here in Milwaukee?
Well, I agree with you. Everyone should be concerned about it, but not everyone is.
I would say that it's important to notice that a lot of the infections that we've been seeing have been asymptomatic. So even if someone feels fine, they could be transmitting the virus. And I think that might be something that people aren't paying as much attention to, the possibility that they may be an asymptomatic carrier.
And we definitely need to make sure that we continue to educate the public, but also our businesses on the importance of wearing a mask. And so if people are going to open up, especially our businesses, I think it's extremely important that we make sure that we're protecting those workers and those patrons. And so if they don't have a mask, we should be providing them for the folks who are walking through our doors.
Okay, thank you. Another mask question. If I wear a mask and those around me do not, and many are not, how does that square with the reason I wear the mask is to protect others and they wear theirs to protect me? Why should I still wear mine?
Because you're a good and responsible person.
Absolutely.
Well, and I think, modeling good behavior may result in other good behavior taking place as well. The more of us that wear masks, the more commonplace it will be, and the more expected. And I think people may get over the fear of looking funny in a mask if more of us are wearing them.
I guess the other thing that I would add to that is that we just have to be comfortable with people wearing masks and get comfortable wearing them ourselves. But it's extremely important that we also think about the biases that also come with people of color that may have wear a mask. And so we have to make sure that we normalize it and make sure that we're setting that biases at the door so people can protect themselves and everybody around them.
Excellent, thank you. County Executive Crowley, are there penalties for individuals and/or companies not wearing masks, following social distancing, or honoring the advised group maximums?
So when you think about the countywide order that was put in place by 11 different health departments, those municipalities, from our conversations, are really want to make sure that we're educating people on the importance of making sure they have masks and are abiding by social distancing guidelines and CDC guidelines. So we're working with every municipality to make sure that we are educating the public and every business about what those guidelines are.
Great, thank you. And another question for you. What has been the most challenging thing for you taking office during this time of crisis?
Oh, well, one, I'm so sick of looking at screens right now. I'm not sure what my eyes are doing to myself, but I think the biggest what makes it really difficult is not being able to interact with the many employees, those who are working on the front lines, our essential workers, to thank them. I have been taking time out of my schedule to make sure that I am covered with a mask to say thank you to our nurses, to the folks who work in behavioral health division, But it is a challenge to come in and transitioning through this time, but we've been managing. Milwaukee County, who's been on the front lines of the COVID-19 response, and we're going to continue to do so.
Great, thank you. Dr. Raymond, you mentioned the need to bring more testing into the community. What can we do to accomplish this?
Well, yeah, that's a great question. We need to fix our supply chain. One of the reasons we haven't been able to do more testing is that people are worried about the availability of those nasal swabs and the chemicals that are needed to do the test. I think more companies are going to be making different types of tests that we can bring into the community that are less expensive and give faster information. And I'm hoping that those will really come online soon. Also, I do want to commend Governor Evers for his commitment to bringing more testing capacity into the state and for mobilizing the National Guard to really focus on communities that need that testing. And Milwaukee had two of the earliest testing sites. I think that's been very, very helpful.
Great, thank you. Next question again about testing. This question is, we are still falling short of our testing capacity. Will there be expanded testing outside of Milwaukee County to address the at-risk populations?
Yeah, the simple answer is yes. I believe that's already happening with some Native American communities and with other rural communities that are under-resourced. But it really depends on the county and their public health department in many cases. And in some cases, if you've got a health system there with a large hospital and a reference lab, it's easier for you to get testing than if you're in a community that doesn't have like a Columbia St. Mary's or a St. Luke's or a Frederick in their community.
Okay, thank you. Next question, I believe is for you, Dr. Beyer. What is the current false negative rate on testing, and how are you incorporating this into the incidence data?
Sorry, I couldn't unmute there for a minute. You know, I don't know what the false negative rate is, and we're not incorporating it at the moment into testing or into our incidence estimates because it's not available in the data that we have access to. But that's a great question.
I can try to answer that. If you do 2 swabs, one deep in the nasopharynx or in the nose and one in the mouth, and you handle the specimen properly, the false negative rate is very low. It's less than 1%. The problem with some of those PCR tests or the Abbott Now, ID Now test that they use in the White House is that the specimen may not have been collected properly. The tests that have problems with false negative and false positive rates are the antibody-based tests. But some of those that have come on the market in the last 2 weeks are much better than the ones that we were trying to use a few months ago.
Okay, earlier it was mentioned that the hope is that there might be a vaccine by the end of the year. This question, this person says that I am hesitant to get a vaccine that has not been fully tested. Typically, how long are trials before drugs are sent to market? Would you as doctors get the vaccine if there is to be one by the end of the year?
Well, let me just start by saying, unless your employer mandates it, most of these are going to be personal choice situations. And it usually takes years, literally, to conduct the safety studies. And you would ideally want that to happen in more than one season, so or more than 1 year. This is such a devastating disease, and we're going to be rushing things to market. But I would tell you that if there's a vaccine available, and I'm relatively confident that it was a reputable manufacturer, then I would get the vaccine. As a frontline healthcare provider, I think you really need to protect your patients.
Okay, thank you. These next questions are related to the recovery and the hopeful time that we can all get back to normal. So this first question is, will schools be impacted in the fall? I've heard that schools are considering virtual starts to the next school year.
We really don't know. I think some colleges and universities have already committed to have full on-campus activities in September. Others have committed to have no on-campus activities in September. And K through 12 is even harder because we know that children in general, when they get COVID-19, don't get as sick as adults do. On the other hand, when they do, they can have terrible and devastating side effects like the Kawasaki-like disease or the multi-system inflammatory disease of children that can be lethal. The other thing we need to think about with kids is they can spread the disease and they may feel just fine. And if they hug their grandparents or their parents, they may pass it on to them. So it's really a hard question to answer.
You mentioned children. Now this next question is actually about them. What are your recommendations for children participating in summertime sports and other activities?
Well, maybe we can ask Christy Brown to talk about a little bit, if she wants to, about the decisions that she had to make about summer activities for the Girl Scouts.
Right. Thank you, Dr. Raymond. We did recently have to make the kind of heartbreaking decision to cancel all of our camps, both overnight and our day camps for the summer, primarily because we don't believe we have the necessary tools in place, personal protective equipment, social distancing practices that would align with what we want for our girls and their camp experiences, and temperature, the ability to take temperature of staff and girls who are coming into camp. So we didn't have any of those things in place already, and we did not anticipate we would be able to do those in time for a productive kind of summer camp experience. So we did have to make that decision recently to close camp. Fortunately, I think people in the community have been very supportive, though disappointed, but they do understand, and they probably also had some concerns themselves whether or not we would be able to have a productive kind of camp season. So that is something we've done at Girl Scouts, and we've done a lot of, in order to help girls still be able to have some sort of Girl Scout experience, we've been able to produce virtual programming so that girls are able to do that with their troops or with their parents during the summer. And we've partnered with Boys and Girls Club to provide handwritten packets that we were able to distribute to the families that the Boys and Girls Clubs have provided weekly meals to. So we're trying to do some things that we can to ensure that girls are having some sort of Girl Scout experience during the difficult times that we're experiencing.
Yeah, I'll also speak to that as a parent. I have a son who's almost 10, his birthday is tomorrow, and he loves sports. And so we've had some heartbreaking decisions to make too, and some conversations with him about what this means and the choices that we have to make to protect ourselves and other people. As a parent, I wouldn't be sending my child to play sports this summer, especially contact sports like soccer, which is his very favorite.
County Executive Crowley, maybe we could ask County Executive Crowley to weigh in on this, because I'm sure that school officials have been talking to you.
I've been on all these webinars and forgot to unmute myself. I apologize. That's going to be a new meme. Unmute yourself. As we continue to have these conversations, I think that everybody understands that we all have to take a step back of what's going on and what has been planned this summer, because we don't have a crystal ball of what's going to be happening with this COVID-19. None of us really understand this, so we have to continue to practice physical distancing. I have to tell you, I hate the term social distancing, because we have to continue to be social to make sure that people can get through this time. But what we have to really do is continue to put the message out there about how we need to protect one another, so we can be thinking about what school looks like in the fall. And the only way to do that is to continue to practice physical distancing, but we have to continue to educate the public in making sure that we're all safe.
Okay, great, thank you. And in that vein, another one for you, County Executive. Will beer gardens open this summer? And if so, do we know when?
So we do not know when. We're gonna rely on the data and the science. So we're going to continue to work with the 11 health department officials across Milwaukee County, as well as the Medical College of Wisconsin, to see what is the safe route for Milwaukee County to take. And so we're going to continue to look at what Governor Evers did with the Badger Bounce Back Plan and make sure we're turning up the dial by looking at the science and data.
Great, thank you. I think we all look forward to those coming back. For the panel, do you have any specific recommendations for faith communities for how and when they should resume religious gatherings?
So I think that there has been some guidelines around that when you continue to have some conversations with the public health officials. Again, we have 11 different ones, and so we highly recommend that those who have their own faith-based institutions to follow up with their local officials to see what those guidelines look like. But if I'm not mistaken, looking at what is in the order, it's about making sure that you have a limited amount of capacity there. We want to make sure that folks aren't necessarily singing hymnals because we know that can help to spread even more. But I think it's extremely important that we look at the amount of the capacity that's going on into these institutions. And if I'm not mistaken, I think the current order that is in place up until the 21st says about 25% of capacity.
Excellent, thank you. Oh, go ahead, Dr. Raymond.
Yeah, thanks, Dustin. I would just add that, obviously faith-based community is really important to people. And I think especially when people are feeling isolated. But one thing just to think about, it isn't just that you're 6 feet away from people, and County Executive Crowley mentioned talking and singing can maybe spread the disease. It's the length of time that you're in proximity to somebody or that you're close to them, and you go to church for an hour or more, you're really exposing yourself not just to other people, but for a long period of time. And I think that's also one of the reasons why people are concerned about going to the barbershop or the hairdresser. Even if you practice social distancing and people are wearing masks, you're inside the other person's physical space barrier for a long period of time. And we just don't know enough to know whether that really makes a difference or not. And I think if people are concerned, they want to be cautious about starting those things back up very slowly and carefully.
Yeah, I might also add that there's been scientific research to show that the virus can survive on surfaces as well. So it's not even just the contact with other people, but with the surfaces that they've been in contact with.
Excellent, thank you. Next question I think might be also for you, Dr. Beyer. Is there a window in the COVID illness where someone who is positive has the highest chance of testing positive?
I do not know the answer to that question. I wonder if Dr. Raymond has a sense of that.
Yeah, great question, and thanks, Kirsten. It depends on the person. Generally, your infectivity, your contagiousness is the highest when you start to feel the symptoms. But if people become critically ill and overwhelmed with the virus, they're going to shed even more virus. What we're hoping for is the 80% of the people that become symptomatic that just resolve and don't even need to go in the hospital. So when you're feeling symptoms, that's generally when you're the most contagious.
Great, thank you. Here's one. I'm not sure everyone always understands the term asymptomatic. I've had some family members that I've had to explain it to. Could you please clarify what the term asymptomatic means for individuals, please?
Yeah, thanks very much. It means you feel fine. You don't have a sore throat, you're not achy, you're not tired, you don't have a cough, you're not short of breath. You can feel perfectly fine, perfectly normal. That asymptomatic is just, it's a Latin term for no symptoms. So that's what it means, you feel fine.
And thank you. And then as a follow-up to that, is there any scientific evidence of asymptomatic spread of COVID?
Yes, a lot of it, overwhelming amounts.
Perfect, thank you. And one more definition. Could you please define the term comorbidity, please?
I'll let Dr. Beyer do that.
Thank you. Comorbidity is basically so morbidity, maybe start there. Morbidity is when there is a disease or an illness, a condition, as opposed to mortality, which is death. And so a comorbidity is when there are two or three morbidities hanging out together. So somebody who may have cardiovascular disease and cancer has comorbidities, or diseases like diabetes and hypertension are often comorbid.
Excellent, thank you. Dr. Beyer, in Europe, decisions are being driven by the R rate, the rates of infection. Why does it not appear to be reported more in the United States?
Yeah, thank you for that. I was actually just on a call this Sunday with my German family-in-law, and they were talking about the R value. I could understand that, but very little else they were saying. We are talking about the R value here. I think perhaps it hasn't gained as much traction as some other measures, but the R value is really critical to understanding the spread, and a very small change in the R value can have a big impact in terms of the number of people that are infected and the speed at which the infection can spread. So I think it is in practice something that we're talking about. I know it's something that Dr. Raymond has used a bit in these talks, but perhaps there was just an earlier adaptation of some other types of ways of looking at the infected rate.
Great, thank you. And another question related to the geographical data that you presented earlier. When examining that data related to infection and testing, how do you intend to disseminate this data back to the community in a way that they will understand the severity of the disparity?
Thank you. That's a great question, and it's something that's very important to us. The project team that I'm working with is working in partnership with the Milwaukee County health departments, and so part of the way that we're disseminating this information is through the health department officials and to the media. We've also gotten requests to share the maps with community organizations that are looking to distribute masks or PPE generally, or to target testing campaigns. I think through these types of seminars, we're certainly disseminating the information. We're also working on trying to put more of them online. And if you go to the MCW microsite, you can see the maps that I showed today, at least some of them on that site. Happy to share them with people who are needing them for making important decisions about where to target their efforts.
Excellent, thank you. Dr. Raymond, are there statistics about the degree of illness in non-hospitalized positive people that they are suffering? Let me rephrase that. I kind of jumbled on my words there. Are there statistics about the degree of illness the non-hospitalized positive people are suffering?
Yes, there is information, and it ranges from people that feel almost normal to people that under other circumstances would probably come in the hospital. They're very short of breath, they have a fever, they don't want to get out of bed, they lose their energy, and we try as much as possible not to hospitalize COVID-19 patients if we can avoid that, because we're trying to conserve the healthcare resources. But people can be very, very sick and still be sent home. And that's why public health monitoring is important. A follow-up phone call to ask how people are doing, frequent checks with either their primary care provider or the local health department really are a strong and important part of the follow-up care.
Yeah, I would add to that the surveillance system that we're using and that much of Wisconsin is using in order to guide efforts, the WEDS system, does have information about symptoms among all people who were tested for COVID-19. So that is possible to examine in greater depth as well.
And I guess one more thing I want to add, it's becoming more and more clear that one of the most important symptoms is losing your sense of smell or your sense of taste, even if you feel otherwise okay. That seems to be now the most common symptom. So that would be something that I think most people may not be aware of.
Excellent, thank you. And then for the panel, it's kind of a follow-up to that regarding the mentioning of hospitals. Is it possible for some of the larger hospitals in our area to have designated floors or areas for the COVID patients so that important elective procedures can be done safely? It is believed that diagnoses are being delayed and also patients needing treatments are also experiencing these delays.
Well, first, yes, every hospital that's reopening is doing their best to separate the COVID-19 positive patients from everybody else. And part of the reason why the hospitals haven't opened up so far, there are actually three. One was there was guidance from CMS or Medicare that we could only bring people in the hospital that had urgent or emergent needs. The second was the hospitals still are worried about their supplies of personal protective equipment. You need to treat every patient like they have COVID-19. And so anytime you encounter a patient, you're going to use that personal protective equipment. I think the third is maybe the most important. People are worried about going back into hospital settings, and we need to restore confidence that it's safe to go back into the hospitals.
I guess the only other thing that I would add on to that is as I continue to have conversations with the medical providers, we are in a good position if we were to see a surge, God forbid. And so I think that they've been having a lot of conversations about if we were to see many more COVID-19 patients coming in, they know exactly what we would need to do as a system in this particular region.
Excellent, thank you. Here's another one for the panel. I have a family member in assisted living in Milwaukee. I have mixed feelings on what is best for her for future quarantining. According to the Badger Bounce Back Plan, people in such facilities are recommended to stay quarantined until a vaccine is developed. Thoughts on this aspect? I want to balance her protection with her mental well-being.
I'm not a doctor, but I'll try to tackle that one. I think that you have to do everything that you can to make sure that you are there for that person. That's one of the reasons why I touch on practicing physical distancing versus social distancing. And so we want to make sure that we are protecting those who are living in these facilities, but also outside of those facilities. So I would just encourage you to continue to have as many conversations, reach out to as many people as possible, and support them however you can while maintaining that physical distancing so we can get over this.
Great, thank you. I want to turn back to there's been some more questions that have come in regarding masks and other precautions that we can take when we're out in public. What are your thoughts on whether people need to wear masks when walking, jogging, biking outside if one leaves lots of space, like 12 feet or more, or crossing the street to avoid others, etc.?
Well, what I would say is if you're outside and you're sure nobody's going to come within 6 feet of you, probably don't need a mask, but that's pretty hard to guarantee. And part of wearing a mask isn't just to be courteous and protect other people. It's to show solidarity, to say we're all in this together. And I plan to wear my mask until we have a vaccine.
And I just want to continue to encourage everybody to wear a mask no matter what they're doing. And even if you may be walking, jogging, or may not have anybody near you, it's just good to have it in your back pocket just in case you need to take a pit stop. And so again, just to echo Dr. Raymond's words, this is a sign of solidarity.
Great, thank you. Here's a question I don't think that we've had before. How can we share how to properly wear the mask? Many are wearing them incorrectly. I've heard, and then as a follow-up to that, I've heard there is some danger in wearing a mask for an extended period of time. Can you talk about why this might be?
Well, there are lots of good videos on YouTube and some information on the Centers for Disease Control website about how to put a mask on. But the things to remember: wash your hands before and after putting the mask on, have it cover your face and mouth, and don't touch the mask when it's on your face. Those would be the main things. And in terms of the danger of wearing a mask, it's if you touch your face or the mask becomes dirty or soiled and you don't clean it between uses.
Okay, thank you. We have about 5 minutes left and questions are still coming in. Next one, is it okay for two people to get together socially if they are staying more than 6 feet apart, not touching shared surfaces, and staying outdoors? If so, are there any other recommendations for how to minimize risk, such as length of time, frequency, etc.?
Well, I would make sure that I comply with whatever your municipality's orders are, if they have one, first and foremost. And there are different recommendations. At the highest level of stringency, that would be not recommended. But if you can meet with somebody outside and not be within 6 feet of them, and you've got a mask on, the likelihood that you're going to spread COVID-19 is pretty low. But again, finding a setting where you can guarantee that is not always that easy.
Yeah, I would say also it's about the sort of the risk-benefit ratio. I think something that County Executive Crowley brought up was the mental health aspect of this too. And it's very important for us to have social interactions and to be connected to other people. But there comes a risk with that if it's done in physical space that is shared. So to take account of that risk-benefit ratio in all decisions that we're making.
Great, thank you. County Executive Crowley, there's an individual from Black Leaders Organizing Communities who's reached out and would like to know how they can help get masks to the people in their community, and if there's a way that they could reach out to you or you guys could connect so you can help support each other.
Absolutely. Well, I would definitely say you want to reach out to organizations like Medical College of Wisconsin. I believe they partnered up with other organizations, MASK, MKE, if I'm not mistaken, to make sure that people can get access to these masks. And so I think it's extremely important that you can get in contact with my office, call my office, and we can find safe ways to make sure that we can distribute these masks in the community. But also into businesses, especially if we know that they're going to be opening up, to make sure that we protect their workers and their patrons.
Thanks, County Executive Crowley. And you've been a leader in trying to connect masks to people in under-resourced communities. If we could put up one of Christy's first slides, I think there was a link for Mask Up Milwaukee, which really is an amazing effort to try to have people make cloth face coverings and surgical grade masks that they can distribute throughout the community.
Website, Dr. Raymond?
Trying to get that up here was on one of Christy's first slides, I think.
Right, it's on the second slide.
Yeah, Mask Up Milwaukee initiative. Yeah, it doesn't have the web link there, but we'll try to provide that.
The slides will be in the handout section, so someone could go to these slides and probably click on that potentially.
Yes, that is.
We post. Okay, go ahead. We posted it on our website as well, Girl Scouts, gswise.org. It would be on there. Some of our social media has that link as well.
It's maskupmke.org, maskupmke.org.
Excellent, thank you. The next question was going to be on resources. So this is definitely a resource that our underserved populations can use. Other than the sites that we have here on the screen, what other resources are available? And as a follow to that, what resources do you recommend people follow if they don't have access to the latest and greatest medical journals?
Well, I'll start with the last and put in a pitch for Milwaukee County website and Milwaukee City website have outstanding information that they update every day. You can learn more at covid19.mcw.edu. The Department of Health Services for the state of Wisconsin has outstanding information. So those would be some good places to go. In terms of getting help and social support, I'd certainly want to start with your federally qualified health centers, your physician's office, your faith-based organization, the health departments for the municipalities, all have people that know how to connect you with resources.
And we have many of those resources. We have many of those resources here in Milwaukee County. So we are still on the front lines, and many of our folks here in Milwaukee County are those essential workers. So anybody who may be having a crisis related to housing, related to mental health, or even issues with their young folk, their children, they can still contact Milwaukee County because we are still providing those services.
I was just going to add, I'm sorry, Dr. Beyer, if there are basic needs that people are looking for, they could also reach out to the United Way, and there's an urgent number for 211 if you need resources and referrals.
And that was the same comment I was going to make, other than to just say it more broadly, nonprofit organizations. There's a lot of people working really hard right now and reaching out to your local neighborhood organizations. I'm sure they have ways to direct you as well.
And I guess I should probably say, if you have a business and you need resources, you can go to the WEEC website to learn more about state resources available as well.
Excellent. Thank you, everyone. That's great information. I have one last question I want to squeeze in here. I know we're at time, and County Executive Crowley, this one is for you. So you've got the last question here. Here we go. We've heard a lot about the challenges of the pandemic locally. Do you see any bright spots or reasons for hope?
I think that whenever you look at a challenge, you have to find the many opportunities within it. And I say that because when you look at Milwaukee County, we have been on the front lines, and it's taken a lot of resources to provide the essential services that we provide. But we have to continue to do that throughout this pandemic. And I think it's going to provide a lot of opportunity when you think about the economic recovery, what that looks like for Milwaukee County moving forward. It's a chance to continue to allow us to build a bigger table, not just here in Milwaukee County and the 19 municipalities, but also our surrounding areas as well. This has been a tough effort, and I've seen business, medical providers, government all come to the same table to find ways to move this community forward. And we've seen some unprecedented partnerships being created because of that. So I think that there's a lot for us to look forward to. We just have to make sure that we just have to make sure and believe that we will get over it. And once we're on that road to recovery, we're going to be putting our best foot forward to make sure that we're not only surviving, but thriving throughout.
Excellent, thank you. Just a quick reminder that, again, these handouts are available in the handout panel. There is the slides where you can get the links, including the one that you see still displayed. And then there's another handout with further testing information as well. And with that, I will turn it back over to Ms. Brown.
Thank you. Thank you very much for attending. Thank you for your questions. Our gratitude and much thanks also to the panelists for your time and your knowledge tonight. We'll be using the results of the poll to determine how we move forward with these town halls. Please keep an eye on your inboxes and on social media to see when we will meet next. Please note that if we did not get to your question tonight, we are adding these to our FAQs on covid19.mcw.edu. Also note that the information shared tonight is available on covid19.mcw.edu as an infographic. Thank you for joining us, and stay well.
Thanks, Christy. Thanks, Kirsten. Thanks, David. Have a good night.